Go ahead.
I'm Janet Serena, and I'm in my mid-50s. And my husband and I are both self-employed, run our own businesses, and so we have to purchase health insurance ourselves. We're not in any kind of a group. And I have a chronic autoimmune disorder called Crohn's disease, and which makes me, if I lose my present health insurance that I have, I am uninsurable. I cannot get health insurance anywhere else. That's a disease. That's one of the diseases that no one will insure you. Even in the state of Montana, they have a pool of last resort that I am not eligible for because through the state, and I'm not eligible for that because I didn't come from I did not come from a group plan, but because we had our own, we're purchasing our own health insurance from Blue Cross Blue Shield. Anyway, I'm locked into this plan that I have now. I can't even, I talked to a health insurance agent, salesman, and asked him, what are my options? And he says, basically, you have no options. If I wanted to, I lost my present insurance, he said about my only other option would be to claim disability so that I would be eligible for Medicare. And that's not right. I can work, it's just I have a disease that's very expensive to manage, but if I manage that disease, I can function. Being locked in this way, it just cuts your options, even to go out and to say, okay, I'm going to give up on being self-employed, I'm going to work for somebody else. If I were to do that, and I were to get, for a time, let's say I got a job that actually had health benefits, and I were to change my policies, I would become part of that group. Then, if I were to some reason lose that job, then I would be lost again. I would be out there with no ability to get health insurance. It leaves you trapped. I just think we really, really, really need preferably a single payer system so that everybody, it's the same, we're all part of the same pool. We're all paying into the same pool, and those premiums are being used to cover the health expenses of our all. But if we can't go single payer, at a minimum, we need a public health option so that I can so that I would have the same health insurance wherever I were to go. If I were to work for someone for a time, I would still be purchasing the same health insurance. I would always be eligible for it. I would not be put in the position of just being in fear of losing the health coverage that I have now. And that's not to mention the fact that the health coverage I have now is bankrupting my husband and I. At one point last year, our health care costs were running over 40% of our adjusted gross income. We pay for health first, and then if there's anything left over, we pay for the rest. This cannot continue. Of course, the older I get, the older I get, and the higher the premiums go. And without options, you're in a pool, and the pool keeps shrinking, so then they start jacking the premiums even higher on you. It's not sustainable. I don't know what's going to happen to us. The system needs to change, drastically needs to change.